We've got to take action to support the needs of the people who are suffering in our community. Our governor, Governor John Kasich, is doing just that. He is looking at those who are suffering most in our community as those that all of us, through our faith, through our moral convictions, say that we want to help. This is one way we can do it. Governor John Kasich.
She was saying, and I don't know that there's a, hi Ray, how are you? There's not a single really thing I can add to it, but what she touched on is the notion that this is always something that happens to somebody else. And I've got to tell you about 3 examples that are kind of stunning to me. They're not stunning, they're just, or they are. I know of a couple, middle class, just normal folks, son's on heroin. He's now in recovery. This is like somebody you would see on television that would be in a normal sitcom, you know. At the Patrol Academy last week, I was not there for the promotion ceremony, but there was a couple that stood up, was recognized. Their son died of a heroin overdose. I'm out at the airport, and a lady who's connected to the TSA says to me, "I'm really glad you passed the collateral sanctions bill to give nonviolent felons a second chance," okay? And I said, "Well, why are you so concerned?" She said, "Well, because my son is a recovering heroin addict 3 times in 1 week." And she says, "If you didn't pass the collateral sanctions bill, my son may be forced to break in somewhere and steal something to support the habit if he doesn't get himself fully recovered." I mean, and then on mental health, I mean, that's something that afflicts every neighborhood, something that can afflict really all of our families. And there, but the grace of God go I. The Medicaid expansion, it's not the only thing. You know, Greg Moody is going to be up here. He runs our health transformation. We're trying to deal with the problem of the premature babies, the underweight babies. And we know that they occur often in families that are poor. And I think when we talk about this is minority health, and it's a lot of the minority health problems, of course, are caused by poverty. But there's one thing we have to realize. Everybody in poverty doesn't happen to be a minority. Everybody in Ohio, I mean, in fact, Caucasians have more poor people than the minorities do in the state of Ohio. So we're all in this together, aren't we? Kind of united by a common goal, which is to get out of poverty. That's what the whole thing is about. But in the meantime, you know, this whole business of a medical home, so we can coordinate people's care. When people go into the emergency room to get their primary care, that's where a lot of poor people go. And how about the working poor? How about the ones that are down there working, 25, 30 hours, have no health insurance? I mean, could you imagine this? Well, see, I can't imagine it. That's why we have to do something about it. You know, one thing we all have to think about, we are Ohioans. We're Buckeyes. And sometimes we divide ourselves in very strange ways, starting with political affiliation or political philosophy. Well, he's a liberal, he's a conservative, he's a Republican, he's a Democrat. One of the great things that I was able to be involved with towards the end of my congressional career was working with the pop star Bono on trying to get aid to Africa. And I mentioned this, Ray, when I was here, I don't know, a couple weeks ago. On these kinds of issues, we cannot be partisan or philosophically isolated from other people, because we all have hearts. It's just a matter of being able to touch those. Am I right, Rev? We got to touch those hearts. And with Bono, one of the things I told him before I left, don't get connected to politics and a political party. Find those people who really want to help you and then support them and work with them. And the same is true here. There are some things that we just can't play politics with. And with people who are in poverty, people who are discriminated against, you got to stand up for them. Pretty interesting to hear a Republican governor talk this way for some of you, huh? Well, but we're all in it together.